Good afternoon, everyone. My name is Joey, and I will be your host today for Next Normal series brought to you by International Medical University, IMU. IMU Malaysia is first and most established private medical and health sciences university with 28 years of dedicated focus in healthcare education. Now, thank you so much for joining us. And before we begin the webinar proper, let's go over some very simple housekeeping rules, which you might already be familiar with. So we have muted the microphones for all attendees. Kindly keep it that way. For questions and feedback, please use the Q&A panel in your Zoom app. And of course, this live session will be recorded. Now, you may have noticed traffic during peak hours is building up. Social places are getting busy, all part of a sign that life is reviving, albeit slowly. So regardless of what stage we're in, the pandemic has certainly changed many aspects of our life. Today, we're discussing how this disruption is changing the way we eat, what we eat, and the way we respond to food. In order to cope with many uncertainties, many turn to food for comfort. Some of us avoid certain food group or food altogether because of the intense fear of gaining weight. These could be signs and symptoms of these eating disorders. Now, the good news is these behaviors can be easily corrected with professional guidance and support from loved ones. Now, joining me today on Happiness Need Not Wait are Ms. Teo Sule, dietitian, Ms. Cheryl Tam, clinical psychologist, and Dr. Nicole Chen, registered counselor. The aim of this webinar is to help you better understand eating disorders, how to seek help, be informed of ways to establish healthy attitude towards food during these trying times. So before I start, I would like to introduce Ms. Teo Sule. Sule is dietitian and clinical instructor in Department of Nutrition and Dietetics, School of Health Sciences in IMU. With 11 years of clinical experience, Sule is instrumental in guiding and coaching final year NND students in their clinical training. She's particularly passionate about empowering patients and mentoring budding dietitians. Her areas of interest include weight management, bariatric surgery, eating disorders, and eating behaviors. Next, we have Ms. Cheryl Tam. Cheryl is clinical psychologist and lecturer in Department of Psychology, School of Medicine, International Medical University. Her clinical experience includes working with individuals with various mental health conditions in the public and private healthcare settings. Through teaching and public talks, Cheryl seeks to empower the community with knowledge on mental health related issues and help address the stigma surrounding them. Last but not least, we have Dr. Nicole Chen, a registered counselor and program director for the Master of Counseling program in the International Medical University. A senior lecturer with more than 12 years of tertiary teaching experiences, she has served as counselor for more than 20 years, and her areas of expertise is on relational counseling, marital counseling, and family therapy. Her current research interests are human resilience, psychological healing, couple and family therapy, as well as women's issues. Now, if you have questions along the presentation, remember to post it in the question and answer panel. We will be organizing them as we go along and have as many of them answered as possible as the session progresses. So let's start. Now, I would like to start with Sule, our dietitian. So Sule, tell us, what is the difference between eating disorder and disordered eating?
It's a very interesting thing. Disordered eating is actually a term that can be used to describe a range of irregular eating behaviors. So they could include commonly seen behaviors like frequent dieting, or they might be cutting out certain food groups because they're on that diet to help meet society standards and pressures of body image. So they might be eating when they're bored, or they might be having the same meal day after day or for a specific meal. But the thing is, most of the time, these behaviors don't actually interfere with their lives. They are able to still find foods that they're comfortable eating with friends, or they might They could be comfortable going to any eateries with their families, and they'll still be able to find something to eat. So it starts to become more of a concern when it starts to take over their behavior, or they even obsess about food, or it becomes a hampering on their functionality. So they may exhibit some more concerning signs and symptoms, such as they may have very rigid rituals around eating and also exercise. They may be preoccupied about food a lot of the times. I mean, most of the time we might be thinking of what we're going to eat for dinner or for lunch next, but this is a very, very often, very frequent kind of preoccupation, or an obsession. They might exhibit signs like a feeling of loss of control around food, or they might even feel guilt and shame associated with eating. So these kind of behaviors that I've just described, they can have a negative impact on an individual's mental and physical health. Mentally, it's because they're just frequently obsessing over the foods that have been eaten or have not been eaten. Whereas physical consequences could be things like bone loss, or sort of fluid imbalances. So you can see that disordered eating does have its own set of concerns. The thing is, it's quite difficult to detect a person who has disordered eating, because you also have to remember that a person who exhibits these kind of symptoms might be undergoing significant physical or emotional or mental stress. But of course, there are those who suffered from disordered eating. They minimize their symptoms and they don't seek help early. And over time, this disordered eating can be a precursor to a full-fledged eating disorder, which there are a few types. Like.
Now, thank you so much, Sule, for that introductions on the differences. Now, my next question is to Cheryl, actually. What are some of the more common and uncommon types of eating disorders?
Right. So, when we talk about eating disorders, yeah. So earlier, Sule was talking about disordered eating, isn't it? But when we talk about eating disorders per se, we are actually talking about a type of mental disorder, yeah. And eating disorders are usually, marked by disturbances in eating, and they can be very serious. They can be complex conditions that will actually impact on functioning, whether it's physical, psychological, or a person's social functioning, right? So it is a serious disorder and potentially can be also life-threatening. Although having said that, if detected in a timely manner, it is a condition that can be treated. So when we talk about eating disorders, I will have to bring in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or in short, we call it the DSM-5. So it is actually a manual, or pretty much like a handbook that we clinicians in the mental health field use for assessment and diagnosis of any mental disorders. So there are certain criteria. So unlike disordered eating that Sule was mentioning about earlier, when we talk about eating disorders, there are certain criteria that must be met before a person actually receives a full diagnosis. Yeah, so it's a clinical condition. The DSM-5 recognizes several types of feeding and eating disorders. So this can include anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder. There's also pica, rumination disorder, other specified feeding or eating disorder, as well as unspecified feeding or eating disorder. So a few eating disorders which we have actually put up over here, right? For example, like anorexia nervosa, bulimia nervosa, and binge eating disorder. They are more commonly observed in older people, or adolescents, or some sources will say that late adolescents, as well as adult population. Whereas this one that you see over here, ARFID, or avoidant restrictive food intake disorder, while still understudied, right, the prevalence is still understudied, but it is usually more associated with children and young adolescents, right?
So if let's say that's the case, right, then can you help us understand a little bit on what are the symptoms of these eating disorders, and also what are the warning signs that we should pay attention to?
Right. So let's go back to the ones that I mentioned earlier that we usually see in perhaps adolescents, adult population. Let's start with anorexia nervosa, perhaps. Right. So we talk about anorexia nervosa. Typically, what we see is a restriction of energy intake. That means they restrict their calorie intake, or sometimes the type of food that they take, right? And this restriction usually may lead to significantly low body weight, right? Sometimes it's weight loss, or sometimes it's lack of appropriate weight gain for people who are still, individuals who are still growing, right? And it's usually, we also observe things like intense fear of gaining weight or becoming fat. Like it's very terrifying for them, right? And also engagement in certain behavior in a very persistent manner that actually interferes with weight gain. Yeah, so that's also another criteria that we usually look at. And then the third one would be disturbance in the way a person actually, you know, experience their body shape or their body weight, right? Or sometimes also their self-evaluation somehow hinges very heavily on the way their body weight, for example. So for most healthy or well-adapted individuals, we say our sense of self a lot of times is, there are many things that contribute to it, right? Maybe partly the way we look, the things that we achieved in our life, the quality of our relationships, so on and so forth. And when we talk about a person with an eating disorder, when I mentioned earlier, this self-evaluation that is, perhaps very much hinges heavily on the way that their body weight. So for individuals with eating disorder, you can imagine the preoccupation, right, about body weight, pretty much, for lack of a better way to put it, rules over their life sometimes. Yeah. And sometimes even when their body weight is so low, there's a lack of recognition of the seriousness of the condition, right? So those are some very typical features of anorexia nervosa. And if you think about it, it can be really life-threatening, right? If it's not detected and it's not treated, because these things have got immediate impact on physical health, right? But of course, as what Sule was mentioning earlier, when we talk about eating disorders, it is never just about the eating behavior itself. That is one of the manifestation that we observe, but it has a lot to do with the person's mental health condition as well. The way they think, the way they feel about themselves.
Okay. Actually, so to expand a little bit on that, sir, so what causes eating disorder, and are they caused voluntarily or otherwise?
Right. I mean, there are several factors that we look into, right? I was wondering if you'd like to talk a bit also about bulimia nervosa and some other conditions that I mentioned before I get
Yes,
into.
yes, for sure,
Then,
please.
yeah, okay. So earlier I was only mentioning anorexia nervosa. So you see the complexity of eating disorders. All that I said earlier, that's just one type of eating disorder. But we have put up, as you all can see our audience may see in the slides earlier, there's bulimia nervosa, and then there's binge eating disorder. They all have got different kind of presentation, right? And if you allow me to talk about bulimia nervosa a little bit, perhaps. Yeah. So
please.
bulimia nervosa is different. It will look different from anorexia nervosa in that there's usually recurrent episodes of binge eating, So what does an episode actually look like? So it's usually characterized by two things. So either eating unusually large amount of food in a very discrete period of time. Usually we're looking at 2 hours. So within these 2 hours, they would eat a portion, an amount that's really larger than what the average person would eat in the same time duration in under similar circumstances. And I think when you look at certain literature, they've also documented that a binge eating episode, if you look into their food diary, it can go up to thousands of calories that are being consumed in one episode. And sometimes, as observed in certain laboratory feeding studies, it can go up to 3,000, 4,500 calories just in one episode. And
That is a lot.
Exactly, it's a lot. And
Yes.
you imagine if they do it frequently enough, what is the kind of impact that it has on that person, right? So that's only one of the features. Another feature of a binge eating episode, we also see a lack of sense of control over eating. So that means what they eat, how much the person is eating, there's this sense that I can't control it, I cannot stop it, right? So imagine it is something that is very distressing for the person. Yeah. So that is just the binge eating episode that we are talking about. But bulimia nervosa also has got another component to it, which is what we call a recurrent inappropriate compensatory behavior. So imagine the person goes through a period, an episode of binge eating, and usually they also find ways to, in a way, expel all these extra calories that are being consumed. And it can be done in a variety of ways, right? Whether it is self-induced vomiting, sometimes it is misuse of certain medications, laxatives, diuretics, and fasting, exercising that's just excessive. So that's also another part of bulimia nervosa. Yeah. And with bulimia nervosa, we also see that self-evaluation is really influenced by a person's body weight, body shape. So these are multiple kind of presentations that you can see. Yeah, and these are our criteria, so to speak, for bulimia nervosa.
Okay, great. So basically, we have spoken about anorexia nervosa, bulimia nervosa, and also binge eating disorders. So perhaps we can now talk about the causes. What causes them, and are they voluntary?
Right. So binge eating, I should highlight before I get into it.
Yes.
It's slightly different from bulimia nervosa because with binge eating, they may have these episodes of binge eating episode that I mentioned earlier, right? So lack of sense of control with eating this unusually large amount of food, but then it does not include this compensatory behavior that is observed in bulimia nervosa. So you're asking about what actually causes eating disorders, right? Yeah. So eating disorders are complex and serious, as I mentioned earlier, and the exact cause of it actually is not as known exactly. Yeah, in that you can't say that a person has got this factor that would definitely go on to experience an eating disorder. We can't establish this kind of causal linkage like that. Having said that, research have also suggested that usually it's a combination or mix of factors that can place a person at risk. Clinically, we call it at risk. But what do we mean when we say at risk? Basically, the person is vulnerable, more vulnerable or more susceptible to having that, to develop that condition. Yeah. So it's usually when we look at eating disorders, it's an interaction of, we say, psychological factors, social factors, cultural factors, biological factors, and if we take a look at each factor, psychological factors, it can include, body dissatisfaction. So those people who tend to be dissatisfied with their bodies, they may be more at an increased risk of having the condition. So in an attempt to move closer to these thin ideals, for example, they may engage in certain, for example, binging, purging, or fasting, and things like that. So that's one. Also, sometimes people who tend to be more perfectionistic, right? So this striving, setting very certain standards and wanting to strive towards it, which is actually not necessarily a bad thing, right? If you think about it, isn't it? Yeah.
Always be better than
always be
yesterday.
better. Yes.
Yes.
However, I think that the darker side of perfectionism, because when we talk about perfectionism, it's actually a personality characteristic, isn't it? And it's usually stable and enduring, and you observe it across different settings in a person's life, right? So some of us may have these high standards when it comes to our work, for example, but people with this trait, you are seeing it across different settings, and there may be a kind of lack of flexibility in that sense, right? So the darker side of it is that sometimes there's also a sense of perceived discrepancy. This is the standard that I have for myself. This is how I should look, for example. I feel that I'm so far off from the standards that I have set for myself, right? So part of that dieting, that binging, that purging that you see as part of symptoms,
Getting
signs and
closer.
symptoms. Yes, it's about, there you go, getting closer to those kind of ideals, at whatever cost that it takes, because this is what I set myself to achieve. I'm going to go for it.
Okay. So basically, there is no it's hard to sort of perceive the limit, whether you are perfectionistic or you're just want to be a better version of yourself.
Right.
Um,
In some ways, you can say that. Although I think what is pivotal here is that there's this element of rigidity, inflexibility about the things that they want to achieve, and I will do it at all costs. When you look at some of the disorders that I mentioned about earlier, there's this sense of lack of recognition about the seriousness of being severely underweight, for example. Right? So these are some psychological factors. We also have some social cultural factors, of course. So, I mean, we learn about social expectations of what, for example, a woman should look like, right? Through a variety of sources, whether it is through our day-to-day interaction, family members, friends, social media, or what we see on the TV, right? If the representation is perpetually thin, unattainable ideal, size 0 is the look, right?
Okay.
And not, I mean, some people by default, their bodies are
Genetically, yes,
yes,
lean. Yeah.
more lean and all that, and it's closer to those kind of ideals, so to speak. But when there isn't a recognition that, is this actually a realistic goal, right? And if it's perpetually, the person is perpetually being socialized in this manner, then how does that impact, isn't it? So
Right.
that's one.
Okay.
And sometimes parental bodily dissatisfaction can also be linked to the children's certain eating attitude and behavior as well, right? So some studies have shown that if parents themselves seem to have some kind of dissatisfaction about the way they look, how does it play out in the family dynamic? Is there going to be a lot of negative comments about their child's body shape, a lot of teasing, a lot of pressure? And when the child, for example, I guess most healthy parents, for example, when they see their child having some kind of early signs and symptoms of what I've mentioned earlier, would be more alert, more vigilant. But sometimes parents like that may actually encourage the child to actually, continue with certain dieting habits, which can be very
Okay.
damaging over time. And not to forget, like peer pressure sometimes, right? Wanting to fit into certain ideals. And some people with certain who are pursuing certain athletic pursuits competitively, certain artistic pursuits, those have also been linked to higher risk of eating disorders, because there's something about looking a certain way that means that you are at the top of your game, you're more desirable in the industry, right?
So basically, while some people are a little bit more predisposed to having to do to have this problem, I think environmental factor also play a big role. So yeah, perhaps we could also hear from Sule from a dietitian's point of view. Have you got anything to add to that?
I think Cheryl covered it quite well. Of course, there are also several studies going on where they're trying to see if there is a genetic link, or are there any genetic predisposition for getting eating disorders. And I guess the work is underway. And then, of course, there's also several studies going into whether is there a certain imbalance in terms of the appetite regulation hormones that sort of contribute to this problem becoming a full-fledged eating disorder.
Okay, so what about Dr. Nicole? From your experience, as a counselor, who are the people who are more at risk, like what Cheryl was saying?
Okay, thanks, Joey, and thanks again all the participants today willing to spend your afternoon with us. Yeah, of course, a lot of people wanted to get to know. So is that I have the specific characteristic or factor that will cause me becomes eating disorder? And I agree with or echo with Cheryl as well, Shule. There is no specific factors or character that actually defining to mean that you are having this eating disorder. But what my observation based on my experience working with client who had experienced eating disorder, I do see this pattern that common come out is it can be related to stresses, just like addressed by Cheryl as well, Shule. But what happens when all these stresses become very overwhelming, overwhelming to someone, It can be a young adult, it can be a young person who finding difficult to managing the stressor. So when they find very difficult to manage stress, especially the stressor is not part of their control. It can be stressors of parent divorce, it can be stressor of academic, it can be stressor of the expectation from the relative or family you have to look good. But because all this is not part of the sense of control, so therefore I had to find a way to have a sense of control on my own. So therefore my body is part of sense of control of me. So I can decide how I want to look, how I want to take care of. And unfortunately, when these are actually going to extreme end, where you wanted to insert control toward how you look, how you feel about yourself, and that where can go into what we call split second can possibly go into eating disorder. So I think that part needed to be very mindful about it, especially when you start to see yourself have this tendency wanted to send a control of a lot of things, especially your own body. I think that's part you needed to be more mindful about it. It's not just about being perfectionist, not just about being good, organized, but sense of control so much, to control of your life can be driving you to another direction that may not so healthy.
Thank you so much. So I guess, in a way, I think we are seeing the pattern there, that it's good to be to have a goal, to want to improve yourself, but I guess, like, one should not be so rigid and so, like, so fixed on a certain idea, right? Okay, so now that we have got all the facts clear, and let's look at some of the myth out there about eating disorder and disorder eating. So maybe Cheryl, we will start with you again, to tell us a little bit about what are the myths about eating disorders.
Right. I think it's interesting that we are highlighting this in this talk. I think really there tends to be a misconception, right? Many misconceptions actually in our society about what eating disorders are, what actually causes them, and it's hardly about being vain per se, right? The idea about vainness, it's hardly just about that, or it's hardly about just food per se, but it's really about how individuals are actually coping with feelings of distress, certain emotions that are very unpleasant, and they do it through a multitude of unhelpful behaviors. So we've mentioned earlier, right, whether it's I think fasting, exercising excessively, whatnot. But I think perhaps through a lack of awareness, sometimes in individuals in the sufferer's environment also may respond to these kind of behaviors in ways that are unhelpful, right? So criticizing and then in terms of lack of control. So you may hear this, right? Eating disorders are really it's a choice. These people just have poor control. Just stop it, lah. Get out of it. Why you cannot stop, right? So you hear remarks like that sometimes, and then something about perception that people who have the disorder are somehow weak, or there's some kind of um, deficiency in the person's personal character sometimes, right?
That you sometimes ask for it.
Yes, and
Yeah, right.
it's really hurtful in that sense, isn't it?
Yes,
And then
yes.
there's a minimizing of the issue sometimes. Oh, not like she's underweight, she doesn't look emaciated also, like not that sick lah. I don't think he or she has an eating disorder, which is not true, as you look at binge eating disorder, you look at bulimia nervosa earlier, not they don't necessarily, fall into that
Appear
category.
to look.
Yes, because
Mm,
of that caloric intake, and it's
mm,
just different in that sense, isn't it? And sometimes
mm,
self-blame by caretakers also. You may hear things sometimes like I think I'm respond I think it's my fault that my child had an eating disorder. What wrong have I committed that
mm,
my child has to have an eating disorder like that?
mm,
And I think
mm, mm, mm,
cumulatively all these things contribute to stigmatization of the condition, and may actually
mhm.
hinder help seeking behavior.
Right. Yeah. So, what about yourself, Sule? What have you seen that, like, that is not right, that people should actually correct their perception, or, be educated about identifying the problem?
I think if I were to speak more from a food point of view, in clinics, we do have parents who are very concerned over their child's well-being when they are undergoing this kind of treatment. So sometimes they may think that, oh, because somebody who has anorexia, for example, maybe the foods that we should be getting would be all the high calorie, high fat kind of foods. Let's just kind of provide that kind of thing. Or if somebody were to have binge eating, then they may say, or pick something which is like healthier or lower fat kind of items. But the thing is, we really don't know if there are any foods that we don't encourage restricting foods or providing more of a certain thing, because we don't really know what may be the trigger foods of these people. So, for example, if person who has binge eating, for example, maybe their trigger foods might be something like plain biscuits, and that sets them off. Whereas an anorexic person may be very afraid of certain kinds of high calorie foods, and by forcing it upon them, you're also not helping in their esteem. You're not helping in how to deal with it sometimes. So it's difficult to say that, oh, so they must eat more of this or they must eat less of this. So we do work to tease out what may be some of our clients' trigger foods.
Yeah, I guess many of us, we try to oversimplifying the problem and just, tend to brush it off without actually understanding the root cause. So it's good that today we are really understanding the root cause. And finally, Dr. Nicole, help us understand, the myth out there, and help us, help family members to address this problem better.
Okay, I think if you really went into doing some Googling, you'll find a lot of, websites looking into a lot of
Dr.
myths.
Google.
Dr. Google.
Yes.
So I think I was able to identify a few which I feel is quite a common that people misconception, which is also highlighted by Sule as well, Shara. I think one often statement come up is like, eating disorder is a choice. You can just change it and then it will be okay. But they've forgotten, the nature itself is a mental illness. So let pictures yourself having a class, watching your lecturers, talking right in front of you. But at the same time, you are putting a headphone, and the headphone will be all these voices, what you should eat now, what you should not eat now. So all these voices like amplifying all inside your ear, and you can't concentrate at all at whatever you're doing at life. So therefore, often working with people who are having eating disorder, they always have this statement, like they're having war with the food. It's like every day is food, food, food. It's the only thing that they find so difficult to even just get themselves to switch off. So you wanted to know it's not a choice. It's something that just inside, it just keep disturbing them. Therefore, they need help. So I think this is very important for us to be aware about it. And I think Cheryl also highlight about, parents sometimes feeling, is that me cause parents? So the statement like, I need to figuring out what I did cause my children have eating disorder. And these parents often like to come here. Nicole, tell me what happened, what have done, what something about my family that caused this. I check it out, my family tree, there's no eating disorder. So all these sort of investigations start taking place by the own parent. I cannot deny, therefore some cases, family stressor do lead to a child having eating disorder. I cannot deny that. But I do not want parent feeling guilty or feeling shame that your child are having the eating disorder. Therefore, you have to put the blame all by yourself. So evidence has also shown by many, many studies, your parent is not the root cause, okay, of the eating disorder. It's all other factor which we already clear. Just now we talk about the facts. So I want you to be very much cautiously aware about it. Another thing that often people take things very lightly, like example, they say, oh, once my daughter with anorexia gain some weight, you'll be fine. Unfortunately, unfortunately for eating disorder, it's so easy to go into relapse. I think if you share with, I think Chef Sule also will agree with me how many often they were seeing relapse cases come back to hospital. Yeah. So therefore we have to don't take it lightly. Yeah. Don't take it lightly because it's like a pattern in coping. As I mentioned just now, when you find difficult to cope your stress, the only way you want to cope is a sense of control. And what you can have sense of control is your own eating or your own exercise. So when they go into distress, they don't know what to do, they go into the same pattern in coping. So I'll go back to
mm,
exercise, I'll go back to into the, eating pattern that I want, so I have a sense of control. So
mm,
again, cannot take lightly, or want again some weight, think will be okay. So still needed to coming together as a family, looking into your family member who are affected, check on them, not check on them like checking 24 hours, more into keeping in touch with them, get to know how they're doing, coping. I think there's
mm,
something
mm,
very crucial.
mm,
Another
mm.
myth that often talk about is, oh, eating disorder is only girl issue. Yeah, actually it's not true, yeah. There's
Okay.
many cases that show that we start to see more male patients coming for help. Yeah,
Mm,
and I personally also came across cases that male client who seek for help, and
mm,
even more difficult for male client or patient because it's so difficult to talk to someone about that issue because it's something like
mm,
you're a man, what? Why are you so particular in terms of food? You should know how to solve your problem. So the expectation of the society toward how men should behave, how men should solving their own problem. So even more
mm,
difficult for male patient to seek help. So I
mm,
think
mm,
want to clear to all of you as well, it can happen to male and female. So do not just have perception it's only girl thing. Okay?
mm.
Hope it helped
Okay.
to understand better. Thanks.
Thank you so much, Dr. Nicole. So I guess, like, yes, I mean, it's not just a girl thing, as gender does not play a part in this sickness. So, and as much as parents or rather loved ones oversimplifying or minimizing the problem, at the same time, on the other hand, you also have some really overly concerned parents and the loved ones. So I think it's about striking a balance. So, all right. So now, once we're better understanding on the myth, so I would like to also pose these questions to the panelists. Who are more prone to developing eating disorders? I think we have talked about genders. Whether male or female. It doesn't discriminate. So anybody can get it. So maybe it's I will start with Cheryl again. So who are more prone, to developing this eating disorders?
Right. So I think really worth highlighting as what Dr. Nicole said earlier, I have to echo it. Just because you're of a certain gender, it doesn't mean that you can avoid predicament of a possible eating
Yeah.
disorder per se, you know. However, there has been some systematic literature review done, right, that looks at prevalence of eating disorders. And there is a particular one off the top of my mind by Gomich and colleagues back in 2019 that and the prevalence data actually suggested that it tends to be more prevalent in women
Mm,
actually. Yeah.
mm. It's prevalent, but it's not doesn't mean that male don't get it. Okay.
Yep. Just
Yeah.
more prevalent in women
Mm,
in general.
mm, mm.
Mm.
Okay. Is it because women are more, I mean, like more critical of themselves?
Which is an interesting question, right? I mean, again, if you go back to the risk factors, right, when we talk about social cultural
Mm,
factors that is
mm-hmm,
brought in, right?
mm-hmm,
Thin ideals and looking a certain way, you know, it depends on culture as well. But generally, is that more commonly associated or um, is it in a way imposed more on females or males in that sense?
mm,
Isn't it?
mm.
So it gets us thinking as well,
Yeah.
right?
And I guess male is about, about having six packs, right?
Uh-huh.
There you go. All right. So, Sule, so from your point of view, from a dietitian's point of view, yeah, what are the facts and figures that can help us, understand who are more prone to developing eating disorders?
If we look at the Malaysian context and we start from what I was explaining earlier about disordered eating, there are actually two local studies
Mm, mm-hmm,
that show that there was one in 2017, which was done among university students because I guess it's due to the pressure from going through that 3 or 4 years and this much assignments, right?
mm,
Um,
mm,
it's worrying enough that about 11% of their study population was showing signs that they were at risk of getting eating disorders. Whereas there was one just last year where they showed that 1 in 5 university students had some form of disordered eating. So
Oops.
you can see that this just emphasizes that it's good to monitor, it's good to seek help, and most of it's associated with stress, as Cheryl and also Dr. Nicole have emphasized again and again. So I guess these people are more prone.
Okay. So I guess, it's like part of growing up, part of, the coming of age stages, rite of passage. So university students hang in there, there's always help. So, okay. Finally, Dr. Nicole, from your experience, who will be more prone? Who should pay more attention? Yeah.
Okay. Actually very difficult to pinpoint, yeah, what character. But I would say maybe I'd like to share my observations as a counselor who serve family, counselor who serve also young adult. And I'm observing one of the phenomenon which I think is often most of mental health professional experiencing when coming to provide support to young adult is the resiliency of a young adult have dropped quite drastically, I would say. So that can be due to many reasons. It can be due to socials where we become very protective to our own children. Yeah, because you only have two kids or one kid, some of the family. So you wanted to give the best to them. So children may not really have opportunity to really understand hardship. So therefore, they do not know really how to cope. So when they go to certain stages of their life, they needed to start to learn, to start to change. Example, from a high school student become a university student. Quite a drastic change in terms of the independence aspect. You cannot bring your parents to you with you to school, to do and preparing everything. So unfortunately, due to that, we do see the resilience among young people is also get, weaker compared many years ago. So I would say, if you ask me, I would not want to more focus into, what is the character. But I think one thing that maybe for all the participants who actually are here, it's time for us to focus more into facilitating the ability of a child to do evaluation in decision making, which I think is very crucial. Example, we look into K-pop. I can definitely see all of them have some form of eating disorder
Disorder.
condition. It can be due to the natures of the career they needed to do it. Yeah, they really have to control the diet to look good in the camera. But unfortunately, it's also sending a very long message to young people. Okay, you have to look like this, therefore you look good, therefore you look pretty, you look good looking. So if I, as a parent or a family, are able to facilitate the ability on evaluating what is right, what is wrong, yeah, what is something that I learn to respect what the best for me. I think that form of ability, which I think is missing in young people. So I think that if you ask me, the factor when a young person, a young adult are not being guided, learning how to do decision making, learning how to do self-evaluation, learning how to coping with all the difficult aspect in life. I would say not just eating disorder, can be any form of mental health disorder they can experience. So that would be something that I like to share as an experienced counselor. Thanks.
Okay, great. So, Dr. Nicole, I would just like you to go on as, as from a counselor's point of view, when should a person seek help and how? And obviously, we want to tell everybody that, from the beginning, we mentioned that these behaviors can be corrected with professional guidance. So, Dr. Nicole, could you just take us through the treatment?
Okay. I think Cheryl related and Surya also can add on. Yeah. Okay. So I actually got few point. I think which Cheryl also have mentioned. I think first aspect you have to observing your behavior. So if you start to see that you go very extreme ends, your daily my thinking you'll be, I needed to control my eating, I need to go and exercise. So it's always filling up with all this thinking and it's disturbing your even your working life, your studies, or your relationship with others. And I think something that you may have to really look into it, especially when you go into the extreme manner in doing things. Like example, intermittent fasting is such a popular approach nowadays. Yeah, and some go very extreme, even not having meal for almost more than 24 hours or even 48 hours. So called extreme effective way in losing how many kg. I believe that you can just quite easily go into Google. Yeah, but what I try to say here is like when you realize that the behavior aspects start to change and you too preoccupied, like what Cheryl said, too preoccupied with all these things. Control your eating, exercising. I think that is something that you really and start to disturbing your daily function. I think do seek help. And second part is the thinking, what the inner voices, where the voices of about food, about exercising, keep filling up every day. You can't even think of any other thing. You had to worry about, okay, what I needed to think about food for tonight or tomorrow morning or the following day. So it's, every day is always about food, and you just can't fill up anything because without you to think and have a control of it, and you start to feeling anxious, and then leading to the emotion aspect where you start to feel like you're extremely having a lot of anxiety, worry when you're not in control of what you're eating and what you will be having, and it start disturbing you to the extent that you just couldn't bear with that how I'm feeling. And that aspect also needed to be mindful about it. It's also not a good sign. Yeah. I think one last part, which is pretty more, I would say the most obvious one, but often people don't talk about it. So you may not know the detail until you really get to know the detail, the biological aspect. I think most of the client who come and seek help or patient come and seek help, I often ask these few questions because I wanted to know how bad the diet plan or whatever affected their whole body system. I think for women, one is very common is a menstrual cycle stop. They were steady having this problem after a few months. They realize that there's no period and they do not know why. And it makes sense because when your body are lacking of food and your body have to find other resources to survive and they can't produce blood to just as a period. So therefore, this is also showing a lot of biological effect caused by eating disorder. You start to feeling very tired and you start to feeling and you start to see especially your loved one thinning of bone, you start to see more like a bone on their body. This also showing the sign that you need help soon as possible. Thanks.
Okay. Thank you so much, Dr. Nicole. Right. So, what about Cheryl? Have you got anything to add on? And I think one thing worth noting is that we talked about the physical signs. So, yeah, and perhaps Cheryl, you can take it on again.
Right. So I think really having to be aware and mindful of some of the risk factors, for example, that I discussed earlier. But having said that, you also bear in mind, yeah, that not doesn't mean that you have those risk factors. You definitely will go on to develop the condition, but rather, you know, to pay attention and be sensitive to changes in certain baseline kind of behavior, right? So, for example, the way they are expressing themselves emotionally, the way they're expressing certain thoughts, the way they are behaving, you know, is this a typical characteristic for that person or not? Or is there a sudden change in it, right? For example, the person, you know, may tend to be a bit careful about what they eat. Has that actually, you know, really intensified all of a sudden? These are things to be very aware of, isn't it? So, I mean, again, if you link it back to the criteria that I mentioned earlier also, right? Is there this kind of expression of fear of weight gain and, you know, expressing themselves as being fat, for example, even when they're really underweight, you know, all these kind of expressions that we need to be aware of. And behaviorally, we know that with certain disorders like bulimia nervosa, there will be this binge eating, right? So is there this tendency of, you know, why is it that they're spending prolonged time in the toilet, for example, right? Because part of the purging sometimes itself in this vomiting, they can spend some time in the toilet doing that. So this kind of changes that we need to be sensitive towards.
Okay. Right. Okay, great. So, what about Sule from a dietitian's point of view? Yeah, when should a person seek help?
I guess this is an add-on from both of my colleagues here that there are mental signs as they've explained it quite well earlier. There's of course physical signs like as Dr. Nicole was saying that if a person starts to look like it's just skin wrapping around bones or there's drastic weight loss recently or just chronic weight fluctuations, that might be a sign. There are also other signs of nutrient deficiencies, like they might have dry, scaly skin, or they have very brittle hair, or you start seeing that there is extreme hair loss. Then that might be a sign. And then they might often feel cold as well, especially for your anorexic patients because they've lost so much weight. We're not talking cold like when you sit in an aircon room, but even like outside, they tend to feel cold. And then we might see certain physical manifestations like they have very fine, soft white hair on their arms and also on their legs. This is a phenomenon that's called lanugo. So that we might see this in some of those who've lost a drastic amount of weight. But just to add on a point that Dr. Nicole had brought up about missing periods, sometimes, as per the physical signs that I've said, they are not the be all and end all. That they are merely just symptoms of possibly a problem which could be eating disorders or it could be something else. Because in practice before, I've seen those who just by a little bit of the weight gain, they haven't hit the healthy mark yet. The periods return, and then that's when people start to relax and think that, oh, great, everything's back to normal. But mentally, there's always going to be that we call it the eating disorder shadow that might be following them. So this physical signs, just take it as it's not the be all and end all.
Okay, thank you so much, Sule. So before we go to the next one more point, I would like to remind all the audience that when you have your Q&A, for your questions, just pop it into our Q&A chat room so that we can gather them. And so far, we have got a couple of questions already. So yeah, don't be shy. Ask us, and then we'll look at it shortly. Yeah. Now, so moving on our discussions. Now that we have already, so now we know when should a person seek help, not just for themselves, but also for the people around them when they identify something that is strange. So tell us a little bit, how does the treatment and recovery process is like? Yeah, so maybe perhaps you can start with Dr. Nicole.
Thanks again, Joey. Okay, help to in terms of what we can do to provide support and help. If you start to notice yourself or your own family members are potentially may experiencing eating disorders, so usually I will propose quickly make an appointment with a medical practitioner, or we call GP, a general practitioner. Or sometimes you can opt to see a mental health practitioner, such a clinical psychologist, or even psychiatric if you wanted to just quickly do an assessment. Why are involving a medical practitioner? Because when the case of eating disorder are pretty severe, normally we need a medical help practitioner to able to prepare a referral letter. So the psychologist and counsel become prepare a referral letter to refer someone for hospitalization. So sometimes we do involve GP, general practitioner or psychiatric to provide assistance, and to do assessment, plus as well to refer the case to hospital. And second thing normally I would do is to prepare the family. I think one part that often very overwhelming when a family receive confirmation from a clinical psychologist or psychiatric or even GP that the child is suffering eating disorder and pretty serious and needed to be hospitalized. I think family often filling up with a lot of guilt and shame. Yeah. Some shame will become with anger, blaming the child, and some feeling bad, they're not doing enough to protect the child. So they're feeling very overwhelming. So what normally I would do, I would start to preparing the family. Preparing family mean that we're taking away a lot of this guilt and shame aspect, because when you are filling up with guilt and shame, you only have a lot of energy to feeling bad about what's going on. You don't have energy to do what you needed to do to help the child. Because for eating disorders, we all agree it's pretty serious thing. And for me, when come to such cases, I always go extra careful, because safety of a client or safety of the patient is my priority, because we are aware that eating disorder can lead to mortality. Yeah, so I'll prepare the family. So best is also talk to a counselor or family therapist to help the family prepare what's going on, so what they needed to do, because because evidence have shown that to help a child to recover from eating disorder, family play a very crucial role. Yeah, therefore they actually come up with this called family-based approach. Yeah, so for this family-based approach mean that you will have to preparing the family what they needed to do, even negotiating meal plan. Okay, so to the extent that okay, what we're going to eat this week, what we're going to do this. The why we reason we had to do this out of negotiation work because when someone experiencing this eating disorder, the voices I mentioned is so loud inside. When you try to change their meal plan, it scare them. And they felt like it's
Mm,
just to the extreme, the anxiety will come and they'll go back to the lab again. So we do not want to
mm,
facilitate that. So what we want to do is to reduce all these voices. Okay,
mm,
tell me what you wanted to eat. Let
mm,
negotiate meal plan, and we slowly using this method, and that's where the voices get less, and that's much more easier for you to negotiating a pattern meal plan for the child or the family member affected. And of
mm,
course, we also support with multidisciplinary support. You can see that the way how I recommend is always a team of people come in. So we
mm,
have a GP, we have psychiatric, we have clinical psychologists, and sometimes once the patient are much more settled, and that's where we're preparing, a dietitian come in, to prepare what to need to eat. And then actually my experience working with patient with having eating disorder, they actually appreciate when you arrange a dietitian, talk about what
mm,
is healthy plan. Because they felt like
mm,
it's also kind of like a plan inside of control. So tell me what is the best, how to go about to do it. I can will not
mm,
put on weight and I'll still look good, but I'm still healthy. So you can be surprised that involving different party, they actually feeling good about it. So so what I try to say here is like the best approach and my understanding for eating disorder is using multidisciplinary approach. You have to involve numbers of people. Can be very tricky the first few early stage, helping family members who are affected with eating disorder. But
mm.
the bounce back or recovering with this support multidisciplinary will speed up the process. Okay, thanks.
Great. I guess it goes back to the saying, it takes a village. Okay, so Cheryl, perhaps we can hear from you. From a psychological assessment point of view, what do you see? Like we said, it's not just one factor, right?
So I think you're, just so I'm understanding your question,
Mm,
you're asking like from a psychologist in my role as a clinical psychologist, right? Like
yes,
what are some of the things that we tend to observe when it comes to treatment recovery, right?
yes.
So I think Nicole actually hit um, most of what I wanted to say as well, because a lot of times, people who suspect themselves of having eating disorder may not come directly to us. They may go to a
Mm,
counselor first, you see. But I guess where my contribution may stand a little differently is sometimes for cases that come directly to me or gets referred by a psychiatrist, for example, right?
mm,
Part of our role is actually doing the psychological assessment as well, because
mhm,
we need to have some clarity about what is it that we're dealing with. Is it really just an eating disorder? And if it is, do we should also look out for what we call comorbid mental conditions, meaning to say coexisting, on top of the eating
mm,
disorder, is there another health condition, mental health
mm,
condition? So it's quite common, things like anxiety, depression, PTSD, sometimes
mm,
substance abuse that can actually happen hand in hand, which makes it more complex to be treated. But it's important, we need to know what we're treating, you see?
mhm,
So generally, I think to kind of add on to what Nicole has mentioned earlier, I think the most effective and sustainable treatment that has approach has got sustainable gain usually is in the form of a collaborative care lah. I think Nicole has
mm,
covered earlier,
mm,
right?
mm,
Collaborative care and psychotherapy is also very important, right?
mm,
So there are
mm,
certain modalities of treatment that are found to be particularly useful. For example, for anorexia nervosa, whether cognitive behavior therapy, family-based
mm,
interventions are important. And
mhm,
for bulimia nervosa and binge eating disorder, like it's cognitive behavior therapy, sometimes interpersonal psychotherapy are also found to be helpful. So really,
mm.
it takes a village. Lah. I have to echo that, you know.
Yeah, I
Yeah.
guess. So I guess, like I think this session has also helped us to sort of expand our support network to, who to go to first, like what Dr. Nicole was saying that, go to GP and then, from then on, progresses, and it takes a wider network of support. But it is definitely possible to get well. Okay, so Sule, so from a NND's point of view, all about the lovely food and perhaps, help us understand a little bit, through NND and through food, how does a recovery journey look like?
I have to say first that there's no way a dietitian will be able to see an eating disorder patient without any help from the psychologists and counselors and also from psychiatrists. So, but I think if there are any viewers out there who are fellow dietitians as well, I would like to remind you that sometimes we may also be the one to help screen abnormal eating behaviors, and then that's where we can start the referral. If you do see that something is wrong, it affects the person's behavior, their daily life, their functionality, don't just take it as a willpower thing. Sometimes that there is something behind it, so I would suggest do screen through. But the objective of treatment from a dietitian's point of view is actually nutritional restoration. So if, for example, you are, for example, if I see a person with anorexia, we will work towards restoring any deficiencies. Will also help reduce the signs and symptoms of these deficiencies. For example, if they often feel lethargic, then we'll try and see how can we incorporate foods that they are okay with in the meal plan, and then that could also help with their deficiencies. And then whereas if I work with bulimic patients, then we're talking about fostering a consistent meal plan, a consistent meal pattern that would minimize the binging also. So it's not just about telling patients what they can and cannot eat. There's quite a little bit of information exchange here where we try to correct any misconceptions, but we also try and understand why they have a fear towards a certain food. And of course, there is the meal plan, which we draft out based on their requirements, but we do negotiate and discuss this with the patient and also with the family, because it's no point having just one party do it, and then when they go home, the likelihood of tantrums at meal times will increase after that. So we do have to work together quite a bit. We also may help our clients or patients with their perceptions of food and eating. So sometimes this can be done one-on-one in a clinic setting, but there are also instances where there are meal groups with other fellow clients with the same kind of condition or same kind of challenges. So dietitians might facilitate that sometimes, along with other multidisciplinary colleagues as well. So, but there are severe cases where, of course, that's when we will start to do supplementation or also artificial feeding. But these are in very severe cases.
I see. Okay, great. So right now, I'm looking at the question and answer channel there. We have got some questions coming in, so maybe we start with the first one. This participant is asking, so in a way, this actually, perhaps we can start with Cheryl. So in a way, disordered eating leads to eating disorder. So, sorry, maybe I should start with Sule, as Sule was the one who opened the session. Maybe you can help us understand a little bit better.
I guess thanks for the question. This is actually the gray area that I was mentioning earlier. So in a way, when disordered eating kind of habits or symptoms where they start being very rigid about food, or they have a certain ritual that they cannot change, or when there is all these feelings where they feel guilt and shame, and then it starts to affect their everyday behavior. They start to obsess over food. Like I said earlier, it's not just thinking about what you're going to have for dinner, but more of like, what am I going to eat at the next meal? How many calories is that? Is this going to affect me or not? Can I find something? So it's running, racing thoughts like this. So when it starts to affect them mentally like this, or even hamper their everyday activity, then yeah, I guess if unchecked, if you don't seek help, then it could lead on to eating disorders.
All right. Okay. So what about Cheryl? Have you got anything to add to that one?
I think again, you can see it as somewhat of a continuum, so to speak, right? Again, eating disorder, you have to meet certain diagnostic criteria. It's a clinical condition, clinically sick condition. Disordered eating, as Sule mentioned also, it's like more so like a descriptive kind of label to it. Having said that, if it is not dealt with effectively at that level, we say that it's always a risk, that it may go on to develop into something more severe in times.
I see. Okay. And what about Dr. Nicole?
I think Jay Sule and Cheryl have covered quite a lot. So I would say that yes, it's more into focus into it affected your daily routine, and you start to feel like you couldn't concentrate, in work and then your relationship. I think that mean that something is not right. Yeah. So I think something have to be done to help yourself. So don't wait until too long. I think one of our crucial concern when the case become very severe, then we have no choice to force feeding. I think there's some cases they will go into hospital and start to feeding the food and they hate it so bad.
I'm
But
sure.
for some cases to keep them survive, there's no choice. So we do not want this thing happen. So I would say that the moment you start to feeling affected, you wanted to stay healthy and yet you wanted to look after yourself. Seek help. Yeah, we are here to able to provide support to you. Thanks.
So we deal with it when it is still a disordered eating rather than to a full-blown ED. Okay, so our next questions is it more prevalent for bulimia nervosa diagnosed patients to have anorexia nervosa afterwards because they have experienced episodes of binge eating and so later on they are afraid of gaining weight, therefore limiting their diet? So perhaps so while you talk, Nicole, you are on, so you might just take it on for now.
Okay. For me, I didn't really do a specific research into it, but my observation, I would say, it's very depend the circumstances of the client. Yeah. So what we can see is what I can see is like when they have this particular condition and they didn't do something about, or they may have an issue with their family or relationship or work, and then often relapse will take place, and relapse pattern can change. Yeah, which we're not so sure how it will be like. So in terms of the clinical aspect, I'll prefer Shule and Cheryl to respond on that. Thanks.
Sure. So perhaps we can start with Sule.
Um, Actually, this is a very curious question. In practice, I have not seen a bulimic patient swing towards anorexia.
Anorexia. Okay.
However, clinically, when we see anorexia patients, we do have potentially subtypes. Okay, so there might be restrictive subtypes, or we might have a binge purge kind of subtype. So the purging here is, of course, not limited to just vomiting, but usage of laxatives or maybe even exercising. So in practice-wise, we may see people who are restrictive anorexics, and they, because they've been bottling up this fear of food and huge restriction in terms of their diet, we do see cases where they swing towards the bulimic side. But of course, this, if we follow diagnostic criteria, which will be done by also the medical side of our team, then they may still remain as an anorexic category, but they may exhibit things like binging kind of characteristics. So it's not common to go from bulimia to anorexia. Not that I've seen in practice anyway.
Okay.
Cheryl.
All right. Okay. So Cheryl, have you seen this kind of antecedents? Yeah.
So I think the question is really a diagnostic question over here, isn't it? And I think Sule has actually raised a very valid point about subtypes. So this is something that's recognized. Again, I have to go back to the term, the TSM5, right? So, earlier, when I presented briefly about some signs and symptoms of anorexia nervosa, what we see very predominantly is that restriction, isn't it? And this fear of gaining weight, and then this sometimes weight loss, difficulty maintaining their weight, and things like that. On top of that, as Sule has mentioned, there are subtypes as well, So a person who is diagnosed with anorexia nervosa per se may actually also exhibit features of binging and purging as well, which, if it's not adequately assessed, sometimes it can be overlooked, and you may consider it as a case of bulimia nervosa. Right, but underlying that, actually, the features of anorexia nervosa is actually still predominant in that there is actually still this problems with weight probably sometimes, right? That the body weight is still low, and maybe also, that quality of restriction, they find themselves, going through phases where they may binge and purge, and then there's this friction, there's an underlying tone of this, still this
Yes.
overarching anorexia nervosa that's still over there,
I
So,
see. Okay.
yeah. So I think sometimes it can be a diagnostic challenge in that sense, lah. But I
Right.
tend to agree with what Sule is saying, lah. More common
Okay.
perhaps, you see, it is actually anorexia nervosa, but they have this
Mm.
complicated subtype that may appear
Right.
as bulimia nervosa also, because they have this binging and purging as well. Right?
Okay. All right. Thank you. So now we're moving on to the next question that is from a dietitian. So this person says, I'm a dietitian who ran an online diet consultation. I suspected one of my clients have binge eating disorder. What would be the best way to address this to them, and what would be the best way to refer them to the doctor? So I think this is about referral. So Cheryl, you want to do you want to make a suggestion?
Right. I mean, in a more straightforward manner, if the client is, willing and voluntarily, seeking for help, which I'm not too sure whether the person asking this question, whether your experience is as such with that client, is actually forthcoming and willing to actually take on this kind of recommendation. But in a very typical sense, I guess the appropriate course of action, as with any other mental condition as well, is to actually go to clinic kesehatan usually, see the general practitioner first, because to get a referral to see you need a referral to see a psychiatrist. You can't, it's considered specialty service, right? You can't access it immediately, so you have to go to KK, get a referral, and then see a psychiatrist. So the thing is, I mentioned earlier, right, that a lot of times individual psychotherapy, the psychologist part of the work has to come in as well in many cases of eating disorder, binge eating included. But the system is as such that in public hospitals, public setting, you can't really access a clinical psychologist directly because we are parked under the psychiatric department. So usually the assessment is done by a psychiatrist, and then where deemed appropriate is referred to the clinical psychologist. So this is assuming it's a public health setting.
Setting. Okay.
Yes, of course, if the patient has the financial means to do it, they can actually access clinical psychologists directly for an assessment first, or the psychiatrist directly for an assessment as well.
Okay, sure. And Sule, this hits home, right? As a dietitian, if let's say this was you, what would you recommend? What would you do?
I really do recommend, if you're unsure, of course, always refer to your colleagues. I mean, psychologists, psychiatrists, they are trained to help fish out the underlying beneath this. But then maybe if you do suspect, there are a few things that you can, a few questions that possibly you can ask to of course give that information, to pass it on to your colleagues so that they would also know. I mean, every bit of information helps in this case. So possibly you might want to elicit some of the things that some of the questions can be what we've talked about. Are they eating large amounts of food in a short period of time? So I guess dietitian to dietitian is like anything that goes way beyond 1,000 calories. So one example could they be eating, say, four Happy Meal, also four McDonald's meals in the span of 15 minutes, which I've heard reported back to me before. But are there any other feelings associated with this eating after the whole session is done? But the other thing is, are they also eating this in secret? That might be another thing that I might ask my clients. And then I guess it's just to be honest in a way, to say that do they actually think that there's anything wrong? And of course, feed this information back to your colleague, who definitely can help better in how to manage it.
Okay, thank you so much, Sule. Now, the next question I would like to address to Dr. Nicole, simply because I think this could be under for minors, right? How can an underage person get help if their parents would not believe them?
Okay, very tricky. Okay, thanks for this question. if a child experiencing certain eating disorders and start to share, often my observation, parents do take it seriously. Unless the parent was just caught, I would say it's like caught surprise, that they normally often go into this deny, nothing's wrong with my child, whatever. So if you do came across a young person experiencing eating disorder are seeking help, maybe I would say that you can be the person to provide a little bit more support to this young person. Okay, rather than talking about eating disorder, which can be quite scary for family member. Be honest with all, I think my experience also, I play a lot of my role in bridging gap between family to refer cases to clinical psychologists and psychiatric. Because
Mm,
often it's very scary for family to know that my child suffering with mental illness. So
mm,
therefore,
mm.
they will try to look for someone who are so-called little bit more mild in terms of perspective where the counselor come in.
More
Yeah.
loving.
Yeah. So they will just come and say, oh, not so serious, right? They will ask. So I would say that if you are a person who was close to this child and then you're able to reaching out to this child, I would say you can play that role. It's kind of like, bridging a gap for this child by talking to the family. Maybe seek help from a counselor who also trained in mental health. Because I want to be very clear because I also acknowledge that not all counselors actually are trained understanding the cases of mental health.
Mm,
However, if you wanted to look for a counselor who actually very much well aware about mental health issue, you be counselor to serve in healthcare setting, like
mm, mm,
hospitals, so they'll be much more familiar. So maybe
mm,
that can be an approach, that little bit more soft approach rather than quickly judge, conclude that this child is suffering eating disorder, but can be someone who get to understand what's going on and bridging the gap by bringing the child and the family to um, to the specialists such as clinical psychologists as well as psychiatric. But I do came across a lot of experience that many time when a family come and seek help, often the child are the one who deny that I'm okay, I'm fine. Yeah, so it's very tough. Another thing that I do came across is also when the parent don't realize how serious it can be, how severe
mm.
it can be. Yeah, so
Yes.
therefore this can be very tricky as well. So therefore sometimes I take it quite seriously. So if the case that actually are much more not severe. So example, I would say like a mild type of eating disorder cases. So
Mm,
IMU Healthcare Center will be like a much more multidisciplinary team that we have clinical psychologists, we have psychiatric, we have dietitian that will able to provide the advice that needed to help you to
mm,
understand better. Yeah, and can link you to the specialist or expert to help. But for
mm,
cases that are much more severe, example, you really see an extreme weight loss. Yeah, and you start to see a lot of condition, example like what Suli had mentioned, skin become dry and then hair become
mm,
preters as well, and periods start stopping for a period of time. So this
mm,
type of sign normally is good to work closely with medical team. You may have to refer the case to hospital, and that's
mm,
where the
mm,
hospital will link to different resources like what Cheryl said. Psychiatric will come in and they will linking to a clinical psychologist, will linking to a dietitian, and the others expert come in to provide a much more comprehensive support. Yeah. So
Okay.
this will be my proposed. Thanks.
Okay. Yeah. Thank you so much, Dr. Nicole. So I think parents, try not to dismiss any issues. Do get to the root of it. Yeah. So okay. So right now we're getting to our next question. Is this person asked how some adverse life events like bully and divorce cause depression and lead to disordered eating, such as stop eating or overeating. So perhaps maybe we'll start with Dr. Nicole for this question.
Okay. Thanks again, Joey, and thanks for the question as well. If you ask, yes, there is possible. Yeah, there is possibility that actually because there is an evidence have done. I think there's one study look into average childhood experience, and they actually have collected thousands and thousands of data from different part of state in US if I'm not wrong, and they actually discovered how average childhood experience actually did impact our mental health. Yeah, not just necessarily specific into eating disorder, but there is possibility. So let's talk about example. If someone as a child have experienced being sexual abused, and due to the child perceive themselves cute and pretty. So when the child blaming the cute and pretty as a blame of her or him being sexually abused, therefore he or she will hate her own body. So I would not surprise she will be taking a lot of food to purposely put on weight to make sure herself feeling safe. Yeah, because when she put on weight, she don't look cute, she don't look pretty, she don't look handsome, and that's where kind of like a mechanism to protect themselves. So you ask me, there is possibility that can impact. Regard to divorce cases, I do came across as well when family relationships are not doing well. And then again, back to the sense of control. I mentioned when environment given to you, you can't have the sense of control, and you have to take back sense of control within your own body, and that's where you may or he or she may opted using this eating method, yeah, to control. So there is evidence have shown consistent that in a childhood experience, bad childhood experience does, yeah, impact toward how we carry ourselves now. Thanks.
Okay, thank you so much. So, yeah, I hope we helped you in understanding a little bit better on this one. Now, our next question is vice versa. I myself had anorexia 3 years ago, and I'm currently experiencing binge eating. So, my question is, are online apps effective to seek help? Also, are there any affordable ways to seek help that you recommend? So, perhaps, Dr. Nicole, you want to start with this as well.
I personally feeling a little bit more skeptical. It's only depend on app, because app involving a lot of self motivation to check into app, follow the instruction from the app to count, like help yourself. But yourself, if you are experiencing difficult time and you're feeling very alone, managing this, and I don't think it's advisable to managing all this by yourself. And that's why actually we have quite consistent talk about it's so important to have a group of support, yeah, to provide the support needed. But of course, you may concern is that you come in a lot of cost. I need to see so many people, but there's always a lot of option as well. There's a lot of NGO actually have that multidisciplinary support. So numbers of NGO actually provides a support as well. So you do check it out. They provide reasonable fees and they do link you to hospital or even government hospital. So you do have option to choose, yeah, rather than worry about the costing. So I just want you to know, do seek help. Don't try to handling all by yourself, because we do see a lot of cases relapse often happen, yeah, when the support is lacking. Yeah, so it's always good to kind of like more compassion to yourself. You deserve better. Okay, make sure that you have support for yourself. Thanks.
Thank you so much, Dr. Nicole. So perhaps Cheryl, you can also shed some light on this one. From anorexia and then developing now is binge eating, and then yeah, so seeking help, affordable way, and the use of apps.
Yeah, so I think the question with the use of app, I think this is quite a heated topic in the field of mental health itself also, and I think perhaps even more highlighted now in the pandemic and virtual sessions, so to speak. But virtual sessions, consultation like that, for example, over teleconference platform, is also not the same as app. I guess um, the challenge with app is that first thing first, you need to know who is behind the app, who are the people actually operating these applications, right? And it's something that as a consumer, I think you have the right to ask and get clarification. Who are the people who are actually operating it? What are their qualifications, right? Although if the purpose is to seek for some kind of assessment to kind of first establish what exactly is it that you're dealing with, you would need a clinical assessment for that. And again, if you go back again, when we talk about eating disorders, you look at different facets, right? People's thought patterns, people's emotions, people's behavior, and also certain physical features also that, it's actually more advisable to see face to face. Otherwise, we can't really make a very comprehensive assessment without that, so at some point I suppose, even if you're doing it through app, and if whoever who is actually handling the app actually suspects anything that warrants further assessment, at some point you will have to come face to face as well. Yeah.
Mm.
So in terms of affordable kind of interventions, So Dr. Nicole was mentioning earlier about non-profit organizations, that there really are a number that is coming up, and especially if you're in Klang Valley itself, perhaps we have more of a luxury of access over here, I must say. So several coming up, available, sorry. And if there's a concern about the quality of service, again, without me making specific reference to any organizations, you can do a quick search and do your own study. These are qualified clinical psychologists, or sometimes what they do is that they have interns. That means trainee clinical psychologists who are practicing under the qualification of a qualified clinical psychologist who is supervising them, right? So usually these places may offer services at a reduced price, yet there's some kind of accountability in the processes where there's actually a qualified clinical psychologist who's actually supervising all these cases.
Okay.
One option.
Thank you so much, Cheryl. So yeah, I think I would like our audience to note that, while apps are tools that are accessible, they are still a tool. So I think and I think with our earlier sharings, we have already mentioned that, this eating disorder or disordered eating, the range of the issue is quite wide, expanding, and there are many facets as well. So the tools like that or apps don't replace one-on-one consultation. So and then perhaps if, let's say, on affordability wise, like, try to go to NGO to start to get the help that you deserve. Yeah. Okay, so I hope we answered that question. So now we have one last question. This touch on fasting. So fasting is said to bring a lot of benefits. How do I know that a habit that someone is practicing or have is or is not an eating disorder? So basically, how do you read into this person's practice that is supposedly good lah for people's health? So perhaps let's start with Dr. Nicole, and then Sule, you can add it on from NND point of view, and then Cheryl can actually wrap it up.
Okay, in terms of clinical aspect, I would prefer Sule to answer that aspect. Okay, but I think the same borderline we try to address it. Event it start to affect your daily. Yeah, you have thinking about it, it affected you, and then it affected your relationship with others. Example, simple, let's go out for dinner. Which restaurant you want to go? What you're going to eat there? So they start to concern, can we eat vegetarian? So you start to have this sort of tension conversation with your family. It's almost like a daily thing, and then you get very affected, and family also feeling very stressed. So I think that means that something may not so right, and then that's where you have to do something about it. Yeah, I think that part, I will say that where family coming together with the family member affected by this, I think we'll be much more wiser when come to have a profession to talk about and discuss. Yeah, before we conclude, mean this person having eating disorder. Yeah. Before I pass to Surya, I remember this one party talking about I don't want to seek medical help. Yeah. So what I can do. So I want you to address that part. If you do realize that you are affected and you're not ready for a medical setting, do consider look for a counselor who actually serve in medical setting. Yeah. So I'm not a medical practitioner, but I'm a counselor. We listen to you. Yeah. But what I try to say here is that we want you to able to also have a platform to look into like what trigger and why you're feeling so not feeling full. Sometimes can be some form of psychological aspect that affected you. So actually talking to counselors or clinical psychology help us to understand what's going on. So you not necessarily have to immediately I'll be hospitalized, I'll be this, I'll be that. So I just want you to be mindful about that. Okay? Thanks.
Okay, thank you so much, Dr. Nicole. So perhaps Sule, help us understand a little bit about fasting and when will fasting become dangerous to health?
That's a hard question to answer, especially after Dr. Nicole had brought up intermittent fasting earlier. Look, with fasting wise, people do it for a variety of reasons. They may be on a diet, they may be following intermittent fasting with a certain rule, which actually honestly does have its benefits. It's been clinically proven as well. But I guess here is that instead of looking at just the fasting, probably let's flip it around a little bit. what's behind that fasting. I mean, if it's for religious purposes, obviously now we're in the month of Ramadan already. I'm not going to tell you not to do it. But maybe look at it. Is this fasting a compensatory mechanism for something? After that fasting, are there other abnormal kind of eating behaviors happening or not? Are there binges? Is there any other feelings of guilt? So it really goes back to what Cheryl and myself and Nicole was also saying. Does this affect their behavior? Does this occupy their minds 24/7? Can they still go to an eatery or a restaurant and still sit down and have a decent meal with everybody? Because although there might be disordered eating, is very funny because there are things that we do, but we have very healthy relationships with food. We call ourselves disordered eaters, but in actual fact, we have a good variety in our diet. We know when we're full, and we still go on with our lives, even if, let's say, we had one big meal and then the next day we're fine. We don't have any feelings of shame or guilt with it. So maybe instead of looking at that fasting, let's look at the other side of it. Is there really anything going on? That's what I would advise.
Okay, great. So, what about Cheryl? How does one read?
How do you interpret that behavior, right? That
Yes,
fasting.
that's right.
How do you interpret it?
Yes.
Good question to ask, really. I think like what Sule said earlier, people can fast for a variety of reasons, whether it's trying to adapt to certain lifestyle, religious reasons or whatnot. But I guess what really distinguishes an eating disorder from regular fasting. So fasting is just a behavior, an eating behavior, isn't it? And that can happen in the context of eating disorder. It can happen without. But I guess a distinguishing point is, again, is there this underlying, idea that, I need to do this because there's this intense fear of gaining weight, right? This intense fear of becoming fat. And this fasting is actually just a behavior that is meant to interfere with any weight gain. So there's this intention of control over there. It serves as some kind of control for some kind of distressing thought for that person, or certain distressing emotion, isn't it? And is there on top of that whether observing also whether or not, I think Sule has mentioned this also, we know that there are subtypes, right, when it comes to anorexia. I'm saying anorexia because when you talk about fasting, I guess one of the more common, it may sit a bit closer to anorexia nervosa, right? Then then we think in terms of the subtypes as well. Is there also this quality where the person after this periods of fasting find himself or herself to have this kind of binges or purges in that sense? We basically we're observing for patterns of behavior, patterns of thoughts, patterns of emotions that underlie that particular fasting, right? And of course, when it starts having the person starts experiencing functional kind of interference, functional kind of impairment, and it's affecting my social relationships, affecting my ability to perform on the job, then that really is something that should be taken seriously, right? Because normal ranges of fasting, if the motivation is, as the person claims, is for health reasons, then it shouldn't bring you down that route, right? Where it starts impairing your social relationships, impairing your ability to function academically, occupationally.
Okay, so I guess like in a nutshell, whether it affects your daily routine, it affects your daily functions, your bodily functions, and so yeah. So I guess we just always have to check in with ourselves. Yeah. So with that, I really hope our audience has got an answer, and so we are already past time, but it has been a very, very fruitful session. So right now, to our last question, we want to leave our audience with an option, with an outlet to seek more information. So where do we get more information on eating disorders? Dr. Nicole, would you like to take us through?
Okay, as I mentioned, Julie, best is to seek centers or places that have this multidisciplinary team. So it's not just only one healthcare provider, or mental health provider, because you have to have a team of people able to provide the support needed. So I can identify presently IMU Healthcare Center is one of the center actually provide a multidisciplinary team. So IMU can be one of the option for you to consider. If you wanted to offer other places, do some search. Make sure that that particular place have a multidisciplinary team. So therefore, you get the whole a team support. But this will be what I'll call a more minor cases, more mild cases. But you start to realize that you are really severe affected, and then you couldn't function daily, and then you are very worried about your health, or your family are very worried. So I think hospitalization may be the option that needed. So that's where, and not to be scared of hospitalization. The reason is because they just wanted to make sure that your general health is there. You have medical professional able to look into your medical condition, which psychologist and counselor can't help. So therefore, we need a team of people who are able to provide the support needed. So I'll say for some cases, you really find that it's much more severe. We always recommended to go for hospital. But make sure do some search a hospital that do have multidisciplinary team.
Thank you
Okay,
so much, Nicole.
thanks.
So Cheryl, from a psychologist's point of view, what would you recommend? Where do people seek more information?
Right. I mean, as what Dr. Nicole was saying earlier also, right? Actually, if you do a quick Google search, you can get all sorts of information online, isn't it? But again, it is something to bear in mind that none of this information, whether the source is credible or less credible, whatnot, it does not replace any formal, medical or psychological kind of advice, right? So I have to echo what Dr. Nicole is saying earlier also, to be wise in where you are actually seeking help, seeking information, your resource now, where is it coming from? And why is it that, I mean, if I were just to add on what Dr. Nicole was saying, why is it that we talk about finding place that has got multidisciplinary kind of management over there? Because again, we know the complexity, after this session, we know the complexity of eating disorders, right? And no one person can claim to know, can be more superior to another person in a collaborative care setting like that. We all have got different ways of contributing. You see, just from this very humble session of ours, there are some questions, about fasting and all that. Maybe, I wouldn't have been able to say things that Sule is able to say because of her background in dietetics, isn't it? And we need this kind of input. And even among professionals, we actually also consult with each other a lot, because no man's an island, and there's no one person who knows better than another person. So that is the rationale to it when we say places that can offer perspectives from different kind of professionals, and primary care physicians, psychiatrists, counselors, sometimes social workers can be involved as well. So not to overlook that.
Great. Thank you so much, Cheryl. So Sule, from NND and dietetics point of view, where can anyone get information?
I mean, there's no other better point I can make other than what has been made by Cheryl and Dr. Nicole. We do have this service in IMU Healthcare. So of course, you can drop by to see us. But for serious cases, we do recommend seeking tertiary health hospitals. They are better equipped. So, but for other reasons, feel free to drop by to IMU Clinic.
Okay, great. So I think with that, it has almost come to our last session. And I think if we're paying attention enough, we do see a pattern of concerns. Number one is that people are a little bit worried about seeking formal medical help. And we would like to once again to remind our audience that no online searches, online information can effectively replace one-on-one formal session, simply because of the fact that you deserve it, and don't self-diagnose. Speak to someone and to get the care that you deserve, because everybody deserves to live well and happy and healthy. All right. So for that, whether whatever this pandemic has brought on, it has brought on a slew of negative impact. But above all else, with a network of support, we hope that we can thrive above. So in regards to relations with food, whether it's eating out, takeaway, or cook at home, food should be enjoyed, yeah, to in moderation. And if the uncertainty has taken a toll on you that leads you to form a very unhealthy and undesirable relationship with food, know that we are here for you. You can just hit us up on in Bukit Jalil. Follow us on Facebook at International Medical University, Instagram at IMU Malaysia, LinkedIn at International Medical University, and Twitter at IMU Malaysia. So once again, I would like to thank all our panel for your time and for this wonderful information that you have shared with us, and hopefully everybody finds benefit from this session. Yeah, thank you so much for your participation, and selamat berpuasa to all our Muslim friends, and have a good day until we see you again. Bye bye.